Good morning, I'm Dr. Marianne Gale from New South Wales Health with the COVID-19 update for today, Thursday, the 25th of November. In New South Wales, in the 24 hours till 8 p.m. last night, there were 276 cases of COVID-19 reported and almost 75,000 COVID-19 tests reported. Across New South Wales, 94.4% of people aged 16 years and over have received a first dose of a COVID vaccine, and 92.1% of people are fully vaccinated. Of people aged 12 to 15 years, 81.1% have received a first dose of a COVID vaccine, and 75.9% are fully vaccinated. Currently in hospital, there are 191 COVID-19 cases admitted, with 31 people in intensive care, 10 of whom require ventilation. Of the people in ICU, 24 are not vaccinated, 3 people have received a first dose of a COVID vaccine, and 4 people have received 2 doses of a COVID vaccine. In this phase of the pandemic, it's really up to each and every one of us to keep each other safe, and especially those who are particularly vulnerable to COVID-19 in our community. Again, I'd like to urge parents and children out there who are eligible for vaccination, who are over 12 years of age, to please come forward for vaccination if you haven't already done so. We continue to see cases of COVID-19 in our schools, and just a reminder again that if any child has even mild symptoms, please don't go to school, get tested and stay home until you've got a negative result. I'd also like to remind people about the use of rapid antigen tests, which are more recently available to us here in the community. Rapid antigen tests are not suitable for people who have symptoms of COVID-19. So if you have symptoms of COVID-19, the best test for you is a PCR test, and to get that in the regular way at a COVID-19 testing clinic. Some situations where you could consider using a rapid antigen test are, for example, before you attend a gathering with people in a crowded indoor or outdoor places, such as a large family gathering, a wedding, a funeral, or before you might go out to a club. You might also consider using a rapid antigen test before you visit somebody who's vulnerable to infection, such as an elderly relative or somebody who has a weakened immune system. You might also consider using a rapid antigen test before you enter a higher risk setting, such as an aged care facility or a disability group home. Rapid antigen tests are suitable for people whether they are fully vaccinated or not. A really important message, if you do use a rapid antigen test, that if you have a positive result on that rapid antigen test, it's really important to take yourself straight away to get a PCR test, because the PCR test is the only way to confirm that you do have COVID-19. And the PCR test is really important as well because it will ensure that New South Wales Health can connect with you while you're in isolation and provide you with care and support while you are isolating. There are effective treatments available, and so it's important that you are connected with clinical care, and it's really important that if you do feel unwell and that if your symptoms are worsening, that you must contact your doctor straight away. So thank you everybody for your continued efforts to stay safe, to get vaccinated, to get tested, and to help limit the spread of COVID-19. Thank you.